Okay, how are you guys? My name is Gordon Asadi. I'm the academic director or the program director at First American Health Institute. And today I just want to introduce to you our simulation lab. This is a lab that it has taken us time to build. We are not yet complete, but we are in the course of completing it. It will be very essential for nurses and nursing assistant, certified nursing assistant, or healthcare assistant, or healthcare support who are planning to go and practice outside Kenya, where the medical field is very advanced. So we have several mannequins that they can utilize to practice, and we are still purchasing more. We also have several medical equipments that they can also come and practice. We will be receiving nurses who want to come and practice here, especially those who are working in the rural areas and they've gotten contracts to go and work in the United States of America, United Kingdom, Ireland, and Finland, and other countries that are recruiting nurses from Kenya. We know those countries. Australia is one of them. So today I just want to give you a brief description of our skills lab or simulation lab. So as you can see, we have a device. This is called Hoya lift or patient lift. If you happen to go to the Western country, you'll realize that most of the time they're not doing the physical lifting. They're using this machine. They'll place some attachment here where the patient will be placed or will be sitting, and then they will use this hydraulic lift to lift the patient from one place to another. So this is our patient. As you can also see, if you come to Fahi, you'll be able to learn how we do the restraint. These are just type of restraint. This one is the common one, and this one is called mitten. As you can see, the purpose of this is that the patient will put it like this and you will tie it. So this patient cannot hit you, and if the patient hit you, you won't be able to feel that pain, and the patient cannot pull the IV lines. And this also will also help the patient because it will help the patient to reduce anything like pressure sores. And this is another restraint. We all know the reason why patients are usually putting restraint, and after putting a restraint, you want to ensure that 2 fingers can go under the restraint if you are a nurse. And remember that an order has to be received after every 2 hours for you to keep on the restraint. I'm not sure about the protocols, but I'm just trying to show you what you learn if you come to Fahi as a nurse who want to learn skills, or just as a nursing assistant who also want to learn skills, especially those who are just about to go and practice abroad. So this is a catheter. We have a mannequin here. This one is colostomies or ileostomies. And we have a catheter here. I won't show you that, but you'll be able, if you've never put a catheter, we can show you how to do it correctly. And we have the equipment here for catheters. So this is the urinary bag. As you can see, it's supposed to be hung here. Remember, it should not be above the level of the bladder. And we have our patient receiving oxygen through a mask. This is our patient. So if you come here, you'll also learn how to place this mask. Okay, so you start breathing. So this is our oxygen concentrator. The oxygen concentrator. So if you come to Fahi, you'll be able to correct this. Nowadays we use this most of the time for palliative care. So you'll be able to learn this. So the oxygen is coming through here, and the patient is receiving the oxygen. You will also be able to manipulate this based on the doctor order. If the doctor order wants you to do the oxygen at 2 liters per minute, you just rotate the dot so that it can point at 2 liters. So this is one of the machines that we also have here. We also have a monitor which is mobile, as you can see, and we have all the gadgets for the monitors. We can do the normal ECG using the electrode. We have several electrodes here. So these are the electrode for the purpose of someone who have never seen them. So this one will be attached on the patient's chest. Usually, we just usually use two. And the blood pressure curve, we also have a stethoscope. And we have the lines here. So you'll be able to see that this thing is able to measure temperature continuously, SpO2, ECG, and also pulse rate. So if you come to Fahi, we will show you how to use this, how to place it on the patient, so that if you go to wherever you are going to, at least you know what you're supposed to do. We also have an air mattress, this one, so we'll be able to show you, because most of the time they use it to prevent bed sores, and it's supposed to run at a particular range. So if you come here, we'll show you this one. I've turned it on. We'll be able to show you how to utilize this. So this is like a mini ICU. As you can see, we have several patients. And if you come to this side, we have an infusion pump. This one is used to titrate medicine. And as you can see, we've attached one of our medicine here. This is glucose. It has been attached to this machine, and we just run it to the patient. So this one is just set. If this one is 500 ml, and based on the order that is written, if it's supposed to run for 2 hours, we just impute the volume and the number of minutes it's supposed to run. Then the machine will be able to pump it continuously within the time range that you've given. And we will also teach you here how to do cannulas, IV lines or granulas. We have several of these. So if you feel like your competency in fixing granulas is not that good, then you can come to Fahi as a nurse, and we'll be able to teach you how to do it correctly, how to use these connectors. We also have a feeding pump. If you ever use a feeding pump, you've never used a feeding pump, then Fahi is the best place for you. If you're going to the West, you'll be able to use this feeding pump even in the medical surge unit. So if you've never used it, you can come here and we shall show you how to use it. It shows the flow rate and also the volume. So some feeding pump have got 2 bags attached to them at the same time. So we are assuming these are our food, and the food is coming here. These components warm this food. So as the food comes here, most of the time they will be attaching the food on a peg tube. So these are peg tube. So this one will be fixed by the doctor, and they will balloon it and leave it there. So the food will be going to the stomach direct or to the small intestine direct. So if you want to detach it, you will have to just pull it. We just have to pull this one out. You pull this one out if you want to detach it, and you return it back. So for those who have never seen a peg tube, this is how it looks like. This one will go inside the body and this one will come outside. We usually put a small gauze on top just to work as the dressing. But this one, it is long lasting compared to feeding a patient using a nasogastric tube. So in most of the Western country, they prefer using this one instead of using a nasogastric tube. So this is the regulator. So this one will be able to write the rate. If they want the food to run maybe 1000 ml to run for 24 hours, we'll be able to do it. So some machines are able to flush. So we'll have water on this side and food on this one, on this side. But this machine can only perform one role at a given time. So you'll be coming occasionally to flush your tube using a syringe. Most of the time, we'll want you to flush it before and after. And before even you feed, you're supposed to aspirate to see how much the patient is retaining. Most of the time, the flushing is done by 60 ml of water. So for the purpose of demonstration, we are assuming that the peg tube will go here and we leave it there. Now for those who do not know how to fix the colostomy bag, you can also come. We have several of them. We'll also show you, our trainers are very competent in this. They'll be able to show you how to fix a colostomy bag. So we fix it this way. If it is filled up, you'll have to pull this, empty it, and return this thing. Now when we count on the components, we have an ECG machine here. And if you've never done an ECG, these are basic procedures for nurses and nursing assistants. If you want to learn about the ECG, you can also come to Fahi and we'll teach you how to use the ECG. We have everything here. We have the gel. This is the gel for the ECG, and this is the ECG machine. The paper's already been fed. This is the cable that electrodes are attached to. As you can see, we have all the cables here, the one that goes to the legs and also the arms. And we have the holders here. We have the holder, the yellow one, the red one, the black, and the green one here. So if you want to learn about the ECG, you can also come to Fahi so that we do it together. And I've already talked about the IV line. If you're not good at doing the IV line, you can also come here and we'll show you how to do it. So these are the veins. As you can see the veins here. We fixed a branula on this patient, and this is a yellow branula, one of the smallest branula. And we've also used a connector here. So this connector can allow you to transfuse different medicine or fluid at the same time, so we can still fix another fluid here so that this patient can be getting two things at a time. So if you're not very good at doing this, you can come here at Fahi so that we can also teach you how to do it. So we have a bed here. For those going to those countries, you'll also find a bed like this. And in those countries, a bed like this is a standard